Hi, everyone. Welcome to Exploring Health, Macro to Micro. I'm your host, Parker Condit. In this show, I interview health and wellness experts around topics like sleep, exercise, nutrition, mental health, stress management, and much more. So by the end of each episode, you'll have concrete, tangible advice that you can start implementing today to start living a healthier life, either for yourself or for your loved ones. And that's the micro side of the show. The macro side of the show is discussing larger systemic issues that contribute to health outcomes. And today's episode is almost entirely on the macro side of that spectrum. And it's a topic that's actually been on the fringes of a few previous conversations. So maybe you'll notice this word or this concept that's come up before, and this will be more of a deep dive into that particular topic. And that topic is health equity. And I can't imagine a better guest to discuss this than who we have with us today. My guest today is Tamara Smith. She's a healthcare executive and health equity leader. Professionally, Tamara is the Associate Vice President of Strategy Advancement for Humana, and she's pursuing a doctorate in public health at UNC Gillings, which is the top public health school in the country. I had the pleasure of seeing Tamara speak at a conference this past fall, and she's by far the best communicator I've come across on this particular topic. So I'm really grateful for her coming on the show. We go over the differences between health equality, health equity, and justice, some clear examples of how this shows up in the real world, how awareness is such an important step to driving change, and how people can make changes at the individual and community level. This episode can serve as a good primer or introduction to people who are unfamiliar with this topic. I think for anyone who wants to dive deeper into health equity, Tamara is also a podcast host, and her show is called Our Journey to Equity. It's excellent. She's a great host, and the production quality is top notch. So it's going to be linked in the description of this show. So if you enjoyed this conversation and want to learn more and dive a little bit deeper, I highly suggest you check out her podcast as well. So without further delay, I hope you enjoy my conversation with Tamara Smith. Tamara, thanks so much for being here. I just want to start off by giving a little bit of context. So we actually got connected through a conference that we were at. You were the opening speaker at the conference, and you kind of talked through a visual kind of outlining the differences and definitions of health equality, health equity, and justice. Mm-hmm. I think this would be a great place to start kind of walking through that image. And I'll pop this up on the screen for people to reference it as well. But I think that'll be a great way to frame the conversation.
Yeah. So thank you so much for inviting me on. And I'm so excited to be able to share more about the topic that I'm the most passionate about, which is health equity. And I do think that's a great way to start a conversation with that visual. So if you imagine three individuals at a baseball game, just enjoying America's favorite pastime, and there's a fence in front of them, and obviously that fence presents a barrier, and they need to be able to see over the fence to be able to actually see the game. And so these three individuals, one is taller than all of the other individuals, and there's a set of boxes, right? So I would say that in one instance, we know that there's inequalities when one person has an advantage that the others don't, and the initial inequality or disadvantage is that one person is taller than the others, and obviously that's by no fault of anyone's. It's just how they were presented and born into the world. And so in order to sort of right and create equality, which is what I think a lot of people assume is what equity is, then that means that everybody needs the same thing in order to achieve the same goal. And the goal in this example is watching the baseball game. And so when we think about it from an equality lens, that means, great, everybody needs a box. So everybody in this instance gets a box. The tallest individual now is seeing a foot over the fence. And I mean, could already see over the fence, really didn't need an extra box, but now they're way above. Now, the individual that's in the middle, which now is, right at that point where they can see the fence because they were shorter than the first individual, but not too much. But then there's an individual at the very end. And this individual, one box is still not enough. One box is really only getting them still maybe a few inches, the fence is still a few inches above them. Even if they were to stand on their tippy toes, they still wouldn't see the game. And so equality is saying everybody gets the same thing and we should all have the same result. And that is the very reason why, from this depiction, equality doesn't really work. Because even if everybody has the same thing, not everybody has the same needs. And so meeting needs has to be something that's more custom fit, that actually goes and says, well, what does this person actually need in order for them to be able to achieve the goal? And what the other individual actually needed was a little bit more height assistance. And then what we realized is that the first person that we began with was already tall enough to begin with and didn't need a box at all, right? And so that person had resources that could have been redistributed towards the individuals that needed it most. And so it's not about taking from one person. It's about making sure that resources are equally distributed in a way that actually helps fill gaps that present themselves for certain individuals. So now equity is this concept that we're meeting the needs that everybody has individually, uniquely. And we're not just applying a one-size-fits-all sort of solution across the board for everybody. But here's the kicker. And this is where I'm challenged. And this is where the field of health equity, social justice, any justice in healthcare related work is really challenged, which is if equity and justice are synonymous terms, which many of us believe that they are, then the question that we really have to push ourselves to answer is, why is there a fence to begin with? Why is there a barrier in between certain individuals and the goals that they're looking to achieve to begin with? And what sorts of things can we do to eliminate the fence, the barrier in totality so that we don't even need to have to, play whack-a-mole with all these resources and trying to solution for all. We really can just eliminate the fence, which is the ultimate root cause of the problem whatsoever. So that's just a broad way to describe and create a picture in people's minds for what the difference is when we're talking about these terms: equity, equality, and justice.
Yeah, thanks for explaining that. And when I saw you kind of give that presentation, it was the first time I had a really clear framework to kind of have in my mind for those particular terms. So hopefully that was helpful to other people as well. And then as you were going through that explanation, you ended up saying it at the end. I was like, oh, it's like getting to the fence in this case. It's like a root cause analysis.
Yeah.
And hopefully we're going to try to touch on some of these things throughout today's conversation. But could you share a little bit about sort of your upbringing and how that sort of led you? I'll probably end up asking follow-ups, but how that ended up leading you towards sort of the field you're in today?
Yeah. So it's funny. I grew up in Florida, and I was just telling a friend of mine this morning, right now I'm in Charlotte, North Carolina, still the South. So for those of you in the Midwest or up north, I apologize in advance for what I'm about to say, but it's cold, y'all, and it's dry. It's my version of cold, okay? I was telling a friend of mine this morning, the air here is so dry. My skin and my hair is not meant for these sort of conditions, and I need to be in the tropics.
You need humidity.
Yeah, so I'm truly a Florida girl. Just the core of my being and my DNA speaks to that. And the part of Florida that I grew up in was incredibly diverse. My little friend group, we just had probably a girl every race in that group. And, I consider myself a geriatric millennial. So, I'm of the millennial type that, you go outside and you just play. And then, at night you come home before the street lights come on. So, we sort of, summers were just full of memories of us just playing with our imagination outside on our bike all day long from sun up, that hot Florida sun. It inevitably rained every single afternoon in Florida. And so you come back out after the rain and there's like steam coming up off of the ground. And, we really had the liberty to create in our minds whatever it was that we wanted to do, to be in those moments, right, in our childhood. And I think for me, that was actually very sheltering, and I did not realize it at the time. I was kind of like this, anti-status quo, little little being running around with my little group of girlfriends, because we had the permission space to dream and to be, and not have to worry about the outside conflict, racial, injustices, and just all the things that you're not really aware of as a child, nor should you have to be. But when I was 10, we moved to the suburb of this area in northeast Atlanta called Marietta Roswell area in East Cobb. And for those of you that might be Googling right now, East Cobb is a pretty affluent neighborhood. And at my first day of school in 5th grade there, I was sort of shell-shocked to be, I think, the only or one of the only Black children in my classroom. It was just a completely different experience. And that would be the rest of my formative experience until really just all the way through, And so I learned very quickly that there was a difference between me and everyone else, and that I was othered in a lot of different ways that I had not previously been in my upbringing. And so what that did for me is that it just created an initial awareness, right? And I remember when I started to, develop friendships, one of my first experiences that really made that come to life for me, we were in the South, okay? So everybody goes to church on Sunday. That's just a given. And my experience with church, I learned very quickly, is very different from many of my classmates' experience. So, Black church in the South is long. You really need to bring snacks, but you can't get caught eating snacks. And you cannot fall asleep. Like, there was no sleeping in the pews, like, just not an option. And I went to spend the night with one of my friends, and the next morning we, had to wake up and go to church. But this was a Caucasian family, and they went to a Presbyterian church, and I think we were out in like 45 minutes. I was like, what
totally new experience for you.
I was like, what kind of church is this? Please take me back. Why is our church not like this? And when we came back to our house, for me, my family, just culturally, we would have Sunday dinners, mac and cheese, rice and gravy, fried chicken. Just all the fixings, right? And when we came back to our house, we had bowls of tomato soup. And I was like, how, where, and when is the chicken coming? So
where's the rest?
Exactly. And, while there are so many parts of that experience that I love, I think what I took the most away from that experience was years ago, and I still remember it so vividly, is how different our cultures were. So going back to your original question about my upbringing, I grew up sort of living in between two worlds with a hyper awareness of where I was from, and then moving into a space where I was all of a sudden needing to be acutely aware of my differences and me being different and my family's experiences being different. And that, kept going along with that was, differences from healthcare experiences, seeing how my friends' families, were aging and, their families and their health, and seeing how my family was aging and our experiences and our health, despite being educated, despite living in the same neighborhoods and things like that. And so I think that I still back then had no idea what it was called and what I would want to do with it one day. I just knew I wanted to work in healthcare, and I knew that there was a there. And so I think that probably the best sort of, way to describe how I grew up and how I got into an interest, at least how that seed got planted in me to do health equity work.
Yeah, that's really helpful. And I appreciate you sharing all that. And you mentioned awareness twice. And one of the things that I had down here for later is kind of the idea of like, where do we go? Where do we begin? Because your first introduction to the awareness of this was very early.
Well,
So my experience growing up, I grew up in a very white area of New Jersey. So I'm coming to this much later, but it did start with awareness and people around me, like making me aware of the situation. So hopefully people listening, if they're also in a similar situation where they're not aware that this is a thing that needs to be addressed, is it fair to say that like that's sort of the first step to this? Because I always end up getting in these conversations. I'm like, I don't know what the first action needs to be, but
yeah.
maybe it's not action. Maybe it is awareness first.
Oh, I absolutely. So, my husband is a therapist. He's a like clinical mental health clinician, and he basically like preaches cognitive behavioral theory. And years ago in my career, when I was doing a lot of one-on-one coaching and really working on the behavior change side of healthcare and working with communities and doing a lot of education, I thought for the longest that if I can just educate people, give them all the knowledge that they need, then that is the, first step to, improving their health behaviors and outcomes. And let me tell you, education is important. I'm a certified health education specialist. I believe in the importance of health education. However, there has to be a level of awareness that occurs in order for you to be able to put the pieces together. So the trans theoretical model or stages of change is a model that's discussed a lot when it comes to how do you actually influence and change behavior. And in that model, there's actually a step called pre-contemplation, and that occurs before you're ever even really thinking about changing anything, And so pre-contemplation is I'm not even thinking about it. I'm not even, it's you may have heard it on your radar, but it's not something that you're interested in addressing at the moment. To get from pre-contemplation to contemplation, that's really the step where you begin to become aware. And, maybe something has happened or you've heard a podcast or, something has, sort of planted a seed that has started to, create a series of thoughts around, a topic that you believe or that you would not have thought previously about how you contribute to or can play a role. So yes, awareness, in my opinion, is really like, level one for us to even be able to enter into any kind of productive conversations about how to transform health equity.
Okay. That's helpful. And I'll try to keep kind of pulling out what I think are steps and kind of asking you like, what are sort of the steps and sort of I know it's not going to be a linear path, but hopefully at least a general roadmap for people and more important, or myself, but other people to follow as well. So can you explain what you're doing with your work at Humana right now? Just kind of parlaying from, your childhood and that early awareness to what you're doing now.
Yeah. Yeah. So, my full-time job, I would say, is out of many, being, a wife and a mom and, for work at Humana. I'm the associate vice president for strategy advancement. And there's a whole bunch that's within that vertical. But just to try to summarize it, I'm responsible for thinking about, number one, what is a national health equity strategy for a payer like Humana to really wrap its arms? And what does it need for a payer to be involved in health equity work? So some of those big, more conceptual, theoretical questions are part of, what I need to be able to answer and think about how the industry is changing and shifting and transforming and where health equity plays a role in a lot of those shifts. But then also, how do you actually measure where you are today and close the gap from where you want to be tomorrow? And so that is a lot of really looking at how do you translate strategy from something that's a concept at a corporate level and at a national level down to the market and into the community where our members, which is who we call our customers, live, work, play, and pray. So there's an implementation side of my work that goes from high-level corporate strategy all the way down to the implementation where it's felt in the communities. And one of the things that we know about health equity is that because it's health inequity, they're so complex, right? It's not, you woke up one day and because you are Black, then you're just, you're just going to be, predisposed to all kinds of inequities. That's not really how it works. I mean, of course, there's abilities that individuals may be born with and things like that. That's somewhat different. But there are a lot of different reasons for health inequity. So it's your environment, where you live, that type of housing that you live inside. Do you have access to green space around your community? Your income, because those individuals with lower income often don't have the resources needed, the time resources as well as physical resources necessary to help support better health outcomes, transportation, food insecurity, right? So all of these things play a role. So, there's not one silver bullet solution that we at Humana that I'm leading that is going to be the one solution, right, that covers it all, because it's integrated. It's very complex. But what we do know is that you can't do health equity because of those reasons. You can't do health equity without also having a really strong community engagement strategy. And so that's the other part of my role, which is leading community engagement work and really defining what that looks like for us as a national health insurer. And so, there's a lot of strategy, very, very heavy on strategy and strategic implementation, but also thinking about what goes on in our market, how can we best support those needs in the market, and how do we really pull the thread all the way through to communities and making sure that we are investing in communities and taking a look at how we can improve the environment and some of those social needs that are impacting individuals' ability to have the same equitable health outcomes.
So on the idea of community, it seems like with all the benefits and upsides of technology, it seems like over the past, I don't know, maybe it's happened for a longer period of time, but I feel like communities are becoming less and less connected because a lot of it is sort of shifted online. Do you have any advice on how to build stronger community engagement? Because I've been having a lot of conversations around social determinants, and it seems like there needs to be policy change for sure and institutional change, but so much of it needs to happen at the community level and with community leaders. And I have so little experience with community leadership and engagement. So you seem to be a great leader. So are there any tips or do you have any advice on how to sort of become a leader, or are there organizations that would be good to get involved in to start building that sort of community leadership piece?
That's a great question. And actually, you're right on target with a growing body of research that's coming out right now related to community engagement and healthcare justice and just, a lot of justice type of fields of work in general, which is thinking about how you redistribute power back into the community. Power, there's a few health equity frameworks out there, but there's one in particular that I'll have to get the name of it for you because I can't think of it off the top of my head. But there's an element of the framework that describes power as a critical element in creating and sustaining health equity. And within that power, it's both how people are, distributed, and as far as positions of power, political power, city councils, things like that, but then also how resources are distributed. I've heard it said so many times, and I'll say it again here, that when we think about all the different food deserts in the United States and certain communities, we really don't have a food problem. There's plenty of food in our country. We have a food distribution problem, and that is as a result of how power is distributed. Policies that basically make the decision for where grocery stores are and why there are some communities that have too many grocery stores, to be honest. I mean, and others where you have to go 2 miles just to get to any kind of fresh produce. And so within that framework, there's a lot of work happening right now that's really taking a look at how do you redistribute power in communities? Because conceptually, if communities had the power, right, that they need in order to make decisions and, change policies to ensure that they can have a grocery store in their community or sidewalks built, that also requires, would enable the redistribution of funds into those communities to invest in those communities and make them healthier and safer and more livable. And so that is a huge issue that I think is a huge part of the solution in order to create health equity. So it's community organizing in an effort to redistribute power, networks of power. Now, the how behind that is really where the research is trying to articulate solutions right now and frameworks right now. So that's a little bit more. Still, I think there are some case studies out there that are really compelling for how it's worked in certain communities. But I would say at the most basic level, it is listening to the community. I cannot underscore how important it is as business leaders, really no matter what your spheres of influence are, is to go to some of these spaces. And what I used to do prior to joining Humana, I worked for a large provider down here in the Southeast. It's a hospital and primary care network. And we used to set up these community listening sessions. And afterwards, I found out that there's ongoing sort of community sessions that happen in Charlotte. But in these spaces, it's the opportunity to ask one or two questions to the community and let them talk back and really understand, what are the challenges that you're facing here? And what is the role that the corporate community and that others can play in addressing those challenges? There are coalitions, neighborhood coalitions, lots of different community leaders that may not have the title from a corporate standpoint, but have a lot of power and a lot of trust in the community that a corporate giant coming in will never have, right? And so working with those individuals is really the key to making sure that you can actually create sustainable and solid solutions. Now, the other thing I will say, though, on that note is on the issue of trust is I think a lot of times, maybe not a lot of times, but in some cases, I've seen different organizations try to come in and work with the community just so that they can achieve their own business goal. And that's not what this is, because one thing about the community is that they're used to groups coming in, making promises, and then leaving after 2 to 3 years. And that is a significant challenge that has plagued and contributed to a lack of trust in the healthcare system and a lack of trust with many of these communities. I think that if we're going to be serious about this, then there's in any business exchange, there's a little bit of give and take. So you have to be willing to understand going into it that you might not be able to get all of your business goals achieved if they don't align with what the community actually needs. And then that's the question. That goes back to the question of, well, what are you really here for? And are we really here for health equity and healthcare justice and for community engagement? Or is it just a business objective?
Yep. The two notes I had jotted down were corporate/government. And I feel like there can be concerns or like misaligned incentives where maybe the people making decisions aren't directly connected to that community. Definitely from a government standpoint, I can see that being the case, where within a city, the people making decisions about, what resources are going to be allocated to a particular district for roads, green spaces, sidewalks, things like that, they may not live there. And there may not be adequate representation. And then on the corporate side, I'm always concerned within the healthcare space of for-profit motives where, are these like community outreach programs just kind of designed to increase a RAF score or anything like that. So it's like you said, it's a multifactorial problem and it's layered on so many different layers.
Yeah.
So it's tricky. Is this some of what you're exploring with you're getting your doctorate from UNC, which is one of the best, or if not the best public health school in the country. Is that what you're exploring there?
It is actually. It's funny. I went into the program not really knowing specifically what I would want to study, but my journey, my career has just sort of left me feeling like the work is so unfinished, and there's something more that I think I need to study, learn, do, right? To really make an impact. And so, yes, I am pursuing my doctorate in public health at UNC Gilling School of Public Health, which is actually the number one public health
I was
school. Yeah,
I wasn't sure. I knew it was always like top three. I knew it was up there.
and I'm looking, I think, broadly at um, both what does it really mean to organize well, organize in a way that can advance health equity. I think to be able to answer the question through a dissertation of does this achieve health equity is really tough, right? Because
Sure.
health equity is so layered, and I would never finish my dissertation, and I'd be like, 100 years old still trying to finish. But however, I think there's a lot, I believe, from what I was studying that we can begin to put in place from the research that has been done. I mean, we stand on the shoulders of giants, right? Folks that have been in this and doing this work for years. And how do we really take from what we've learned over the past, several decades and what we're learning now and develop the right sort of frameworks to help us organize, whether it's in the community or even in the corporate space, in the payer space. What do we know from best practices that can help us organize and understand how to set ourselves up to advance health equity work? So it may not be no silver bullet or this is the single most effective solution, but we know that these things have contributed to successful outcomes related to, closing gaps in care or, all of those leading indicators of achieving health equity. So I'm sort of in that space right now where I think I am in pole position to really look at the corporate community and especially the payer community. But my first love and passion is community engagement, like the actual, sort of grassroots, boots on the ground work. So I'm figuring it out, but I definitely think that is where my research is going to lead me.
Yeah, that's great. I think it's really important to have sort of a foot in both worlds, as you mentioned, where, being able to operate in that corporate space where you're going to have that influence, but also having the expertise and experience and the original like love and passion for the community engagement side of it as well.
Yeah.
I'm sure it's going to be a very interesting dissertation. Challenging.
Hope so.
Challenging for sure.
Let's hope I finish. So
I'm sure you will. Can we kind of get into some of the specifics around this? Like, can you just kind of rattle off some of the current barriers? And then I'd love to be able to circle back to trying to kind of root cause analyze, like, where do these all come from? Because I think to move forward, it's really important to understand how we got here.
Yeah. So I'll actually take that from maybe a slightly different lens. So we know that, social determinants of health are sort of what we know are the midstream sort of barriers to affecting health equity. So what we see sort of downstream are things like mortality rate, differences in mortality among racial groups or higher prevalence of certain types of cancer and LGBTQ communities. We may see, differences based off of zip code from chronic disease rate. Those are the things that we see downstream on the surface. I think, a lot of times it's used, this iceberg picture is used to describe what we can see on the surface, but we know underneath the surface of this, there's like this massive structure, right? So to ask ourselves why we see what we see on the surface, it's just, asking why, why does that exist? So why that exists is because, perhaps there's we already talked about a lack of healthy food, which, if you are in a community where, it's not very walkable, you're working a sedentary job, there's not healthy foods around you, you are sedentary and, you're got diabetes and the foods that you're eating are not helping, right, to manage that well. So, it's all those things. So it could be food, it could be housing, some of the things we talked about earlier. It could be just health discrimination, just in general, our own implicit biases. So when you're going to a healthcare provider to seek care, there are multiple unfortunate documented instances of healthcare providers just either not taking seriously the concerns that the patient has when they present them, thinking that individuals are just being problem patients. So there's a lot of assumptions, our implicit biases that are brought to the table because we're human and it's just the way that our brains are designed. And if you're not trained appropriately to check those biases and to understand that you may be practicing and making decisions with biases, and you need to, just sort of practice with a questioning attitude, right? As a value. Then what we see in the iceberg is just a lot of inequities with the rates in which certain individuals might be diagnosed late for certain conditions or diseases, or just go completely misdiagnosed, right? Because the providers may have thought that they were just making things up or, just drug seeking, which is something that we see a lot in literature. There's a lot out there about using AI to detect bias in electronic medical records. And that's a real thing that we're seeing today, is that there's bias in the way that certain patients, either by race or sexual orientation, their notes are written differently in comparison to, white patients with the same concern. So racial discrimination, right? So when you start thinking about, well, why do these individuals live in areas or are subjected to lives where resources are limited? The answer to why goes back really to racist policies and really truly discriminatory practices that have occurred just historically in the United States, where we've got, communities that were historically redlined during the Jim Crow era, and where minority communities were intentionally disinvested in during that period of time. While that was years ago, and I think a lot of times people say, well, come on, like we moved on since then, why haven't, these groups of people moved on since then? I think if anybody out there is getting their dissertation, another thing that is really key for us to understand is really the true impact of years of systemic oppression, because that happens in the mind. And so when you think about like really the root to why some families are just suffering from generations of poverty, cycle of poverty, and it's just so hard to get out of that cycle. It's not like, oh, well, we're just going to bus you over to a school in a different district and you'll be fine. Good luck. It's not quite that simple, because they and their families have been subjected to truly years of oppression that have, sort of changed the way that individuals think, move, and feel, and move about the world around them. And so what we're talking about is really, really complex. But I do think that it begins, like we started off, it begins with awareness. Having that initial awareness about really what the root to many of these problems are, which is largely rooted in policy and largely rooted in just culture of, racism and discrimination. If we can address those issues, we will do ourselves a lot of justice, and we will go much further in actually impacting health equity in the long term than trying to create like quick fix solutions here and there in the middle.
Which is concerning because it seems like in the US in particular, in the healthcare system, so much of it is let's treat the symptom and not the root cause.
Yeah.
So I do worry when it comes to things like this. It's like there's going to be a lot of Band-Aid solutions where I think it's good to address things from sort of the top of the iceberg perspective, as you were describing it, where if you're talking about like maternity care, so just to give a concrete example, I think Black women are 3 times more likely to die after giving birth than a white woman. So there's obviously you can do training in, maternity wards around that. And that's sort of the top of the spectrum, sort of trying to address that. But it goes down to why are maternity wards generally money losers in hospitals? Why are OBGYNs generally the lowest paid procedural specialists? That's a gender issue. So there's so many more layers you can go down to. And I think this is what you're getting at, where it's how do we address those? And this is where I come to the question, I don't know what to do, right? So we can have these conversations. And I'm like, what's the next step? I think awareness is good, and I'm still learning. I think a lot of people are still learning. What do we do next? Like, I understand this is like the premise of your dissertation and so much research. It's like, where do we go? It's such a challenge.
Where do we begin? Where do we start? I think I get asked that question daily, honestly. And it's not just individuals like you, individuals that I work with, individuals in the community, folks from other sectors that are, trying to figure this out as well. And so I would say that because it does feel really overwhelming when we start really thinking about what's underneath the surface and where all of this began. And like, these are people that made decisions before I was even alive. And, now we're here to clean up the mess. So first and foremost, let me just say that I completely honor, and I think we just need to respect the fact that this is really, really complex and hard. But just because something is really, really complex and hard, I would challenge us to not think it's just too much to deal with. I can't even begin. I think that what I tell people is that the place where you begin is where you have influence. Don't try to go somewhere else where you have very little influence or expertise, and try to do something there. Begin exactly where you are. So, invite someone on your podcast, for example, to talk about these issues and health equity, because you never know what level of awareness that might contribute to someone else that's listening. Another place that you can start is right in your community as you are, hearing about policies. Everybody sees the little zone thing, as you're driving around in your community. What is being zoned and why, and it's not necessarily to say don't walk around, with a tablet, writing down all of the zoning codes, but have a level of awareness about the decisions that your city council is making, your local politicians are making about your community, and join groups in the community. And in this day and age, you can Google, okay? You can Facebook, whatever community you are in. I am telling you, if there's an organized group that's talking about it, you will be able to find them. And if that's a little bit outside of your wheelhouse, start where you are in your profession. Begin the conversation. What are we doing? When I first joined Humana, I was listening to these weekly calls we have, all of the different pilots that get tested in the organization. And I love that because I'm an ideas person. I just love to hear about all the different patients that are being tested. But one of the things that I realized very quickly is that there was not a race ethnicity view on really any of the pilots. And so every time I would have to come up to you and say, hey, have you guys considered, really looking at the race ethnicity? Hey, hey, Tara Smith here about health equity, so it's such a small question to ask, you would think, but in the grand scheme of things, it's kind of like one of those, pictures where there's a million dots up close, and then take a step back, you zoom out, and you're like, oh my gosh, this is a masterpiece, So it's one of those situations that you got to think about what you're able to do where you're able to do it. Because now there's an entire cultural shift that we're experiencing inside the organization where we're looking at things differently from a health equity. I'm not saying that, my little question was the thing that shifted it, but it got everyone thinking about it, right? That was all those calls. And then they go back to their spheres of influence and they're thinking about it and they're talking about it. So that's all this is really sort of being comfortable and courageous enough to ask the question, right? And then from there, what can we do here in order to make a small change? Don't try to attack the whole iceberg. Come on, like a small change. We're taking one step at a time around this sort of behavior, stages of change in order to get to that masterpiece that we can all zoom out on.
I think that's great. Yeah, because I think anytime you're taking on something new or challenging, you're going to need some small wins in order to keep going. If you don't see any progress for 8 years, nobody's going to do it. So I think it's great advice to kind of work within your sphere of influence, talk with your friends, have these conversations. And then, you'll be able to slowly but surely change minds. And then they're going to be able to do the same thing. You can sort of get this cascading effect. Tamara, I could talk to you for 3 hours. I want to be respectful of your time, though. Do you have any closing thoughts for the listeners before I let you go?
Oh, man, this has been a dream. Really enjoy. I mean, I too can talk about this for hours, clearly. I'm not sure that everybody would want to listen to me talk about it for hours, but
I think they would.
Well, if you are interested in talking to me about it for hours, I do have a podcast called Our Journey to Equity. You can find us on YouTube, really anywhere where you get your podcast. I'm on Instagram at Our Journey to Equity, where I do very similar things, where I'm looking at who's doing this work, what their experience has been, and how can we chip away at the iceberg, one chip at a time. So if you're interested in learning more, listening more to me go on and on about this, that's where I can be found.
And it's excellent. I watched a few episodes this past weekend with my partner, and it's very well shot. And you're a great host, a great communicator on this topic. I'll certainly link to that in the show notes as well. But I just want to genuinely thank you. This was really helpful for me. I hope it was helpful for the listeners, and I really appreciate you coming on.
Thank you. Thank you so much for having me.
Hey everyone, that's all for today's show. I want to thank you so much for stopping by and watching, especially if you've made it all the way to this point. If you'd like to be notified when new episodes are going to be released, feel free to subscribe and make sure you hit the bell button as well. To learn more about today's guest, feel free to look in the description. You can also visit the podcast website, which is exploringhealthpodcast.com. That website will also be linked in the description. As always, likes, shares, comments are a huge help to me and to this channel and to the show. So any of that you can do, I would really appreciate. And again, thank you so much for watching, and I'll see you next time.